Today I can announce that the Northern Beaches Hospital, as a result of a negotiation between the Treasurer and the Health Minister and Healthscope, will return to public ownership and control in New South Wales. Mr Speaker, this comes about as a result of an in-principle agreement struck that will see $190 million transferred to the owners of the facility. But bear in mind, Mr Speaker, the original contract had north of $800 million as an exit payment to the private owners. It will mean, Mr Speaker, an end to what I think is commonly understood to be a disastrous decision by the previous government to outsource to the private sector emergency departments. A basic and fundamental responsibility of governments, state governments. And for those who are unaware, this was one that snuck through, but there were another four across New South Wales that had been earmarked to be effectively privatised by the previous government. We are talking about not private hospitals, we're talking about privatised emergency departments. And clearly, Mr Speaker, residents of the Northern Beaches, people right across New South Wales were not unreasonably concerned that you'd have a situation where you would be treated by somebody in those circumstances where the managers were worried about the bottom line, the P&L, the return to the investors, the owners of the hospital, rather than basic emergency treatment for people who are in desperate need, Mr Speaker. And the most glaring and terrible example was the circumstances relating to Joe Massa, a 2-year-old who died in the care of Northern Beaches Hospital, and whose parents, Eloise and Danny, have fought a passionate, tireless campaign to return this hospital to public ownership. Nothing can ease the pain associated with losing your child, but the burden that Danny and Eloise have borne to bring this issue to the public's attention, to see a change, was for one simple reason, and that was so that another family didn't have to go through what they've gone through. Yeah. And we owe them a huge debt of gratitude for that, both Danny and Eloise, and thank them for their tireless support in relation to this, Mr Speaker. We expect public administration of the hospital and ownership to be done in 2026.